Hello, my name is Marcy Lawing with TriageLogic. Telemedicine is quickly becoming a household word. Where 15 years ago there was very little known about this remote method of healthcare, today it is becoming common in doctors' offices, hospitals, and insurance companies. Many companies even offer nurse triage services to their employees. Patients are presenting with increasingly more health concerns. Many suffer from comorbidities and take multiple medications daily. Nurses have to be alert for any red flags or indications that their patient may need medical attention quickly. If you had to guess, what do you think brings the most healthcare-related lawsuits? It's delay of care. A delay of care can happen when a patient's symptoms worsen and the patient has not been adequately advised on when to seek medical treatment in time to prevent injuries or even death. Take, for instance, 6-month-old Georgia. Her mother is calling nurse triage because Georgia has been sick with cold-like symptoms for almost 2 weeks and now has a fever. Georgia seems more tired, and mom describes her as being drowsy. She's more clingy than normal and cries more often. While there may not be any obvious red flags flying after hearing this information, the nurse should begin thinking worst-case scenario. I won't give too much away. You'll have to check back soon for our risk scenario course to find out what happens to baby Georgia. All medical professionals practice their jobs with some risk. Nurses are no exception. The teletriage nurse must be sure and practice nursing just as any other prudent nurse would in a similar situation. Our course on risks of teletriage will take you through several typical patient encounters. See if you can pick up on the red flags that would affect the patient outcome. While listening and watching our video, you will learn how triage nurses should ask open-ended questions to elicit the most accurate information from the caller, how they use their critical thinking skills and nursing knowledge to thoroughly assess each caller, and the role protocols play in adding a layer of legal protection. In our upcoming course on the risks of telephone triage nurse, you will become familiar with terms such as delay of care and the importance of following standardized protocols, such as the ones we use here at TriageLogic by Barton Schmidt and David Thompson. Using protocols properly assures that the assessment is approached in a systematic way, which further reduces the risk of missing important information that could change the disposition of the patient. Be sure and check back soon for the full Learning Center course on risk management.